Good afternoon, everybody. Thank you so much for joining us today. I'm very excited. I know I say this every week, but these opportunities to talk to healthcare providers in the state of Nevada and just all the great things they're doing really does make me excited. So I'm very excited about today's Q&A. It is with health, access to healthcare. I have two wonderful participants joining me today. Dena Mayra is she's been with the Access to Healthcare team for 8 years, which is commitment, and I love seeing that kind of commitment, Dena, so that's going to be awesome. And I'm going to read this. I'm reading her bio a little because it's really good. She is Director of Access Medical Programs, which she's going to tell us a little bit about, and I feel is really important for us here in the city. And joining her is Mayra Garcia, who is the Access Medical Cancer Care Coordinator, which obviously is something that is near and dear to our hearts. So I just wanted to thank you ladies for joining us and welcome you to today's Q&A.
Thank you for having us.
Yes, thank you for having us today.
Oh, are you kidding? I'm like, it's so funny. I say this every time. I'm like, yeah, no, I wouldn't be here if it wasn't for you guys. And I know I am admitting up front, one of the reasons why I really wanted to do these, it's a pretty selfish reason, I just feel that it's working out for everybody, is I don't know what you guys do. I know that it's good because you're trying to help people, and I think that's awesome, but I really, really, really think it's important that we totally understand what you're doing. So tell me about the overall vision and service of Access to Healthcare.
So Access to Healthcare has been around for over a decade. It's a local nonprofit. We are statewide. We're even in the rules.
Oh, awesome.
So clear out to Elko. Any which way in this state, we're here. And when it started, the whole idea was, how do you bridge that gap to healthcare for the uninsured?
Mm-hmm.
So when it was, doctors were involved, CEOs of hospitals with our CEO, and everybody came together with this thought that, what can we do as providers to help that bridge? They came up with a shared responsibility model, which is Access Medical, the program that Mayra and I are in. And that thought process was, okay, if we do this, as a provider, we're giving back to the community by offering drastic discounts to these members who pay a monthly membership fee to be a part of Access to Healthcare Network. And as long as they're a part of that program and they pay a time of service, they will have access to these discounts. And our discounts are large, 70% and up for our discounts. Our providers are phenomenal. So across the state, we have over 2,000 providers. We're contracted with the hospital system, surgery centers, primary care, dental, ophthalmology, you name it. We have a little bit of everything. I mean, we even have contracted for facials and, anything ancillary that you could think of, because just because you're uninsured, maybe you're a lower income, because our income is 0 to 250% of the federal poverty level, doesn't mean you still don't want the same services, like going and getting massage at a discount and all that, because we believe in exactly in the full circle of care. We have discounts for mental health, you name it, we have it. And what's really unique about, what I love about Access to Healthcare Network, is we have a call center. And so when someone comes in, they call that call center, or they can come in and see someone from our call center. And the call center has just this abundance of questions that they're asking. And with those questions, it's like, where do you live? Do you have this, do you have food insecurities? Do you have this? And then as they answer yes, no, it puts them in the different pockets out of all the different programs we have where they would go. So say they're uninsured. We would then see, do you qualify for Medicaid? Do you qualify for something on the exchange? If they do not, okay, then Access Medical is your program. But then in the conversation, we realized that, they're 55, they have no transportation to doctor's appointments. Well, then the call center is going to send a referral to our internal transportation program.
Mm-hmm.
Then if they say, well, we have food insecurities, we're going to give them information on how to get food. Not to mention, we have a few food programs. So if they qualify for ours internally, they'll internally get referred. If not, we refer them externally. We have Women's Health Connection under us. So if it's a female, we'll say, when was your last mammogram? And if they
Right.
say, well, I haven't had a mammogram in 3 years. Okay, well, did you know you also qualify for Women's Health Connection? We're going to refer them internally. They're going to be reaching out to you to start that process. Then if they say, well, I have diabetes, we're going to say, well, we have diabetes self-management classes. So we're anything internal that we will, so they could start with one phone call to get on Access Medical, and by the end of that phone call, they're signed up for 6 programs here.
Okay. I am about to cry in such a good way. Okay. And this is why I do these. I admit it is fully selfish, not in the sense that I want to tell all of Nevada about that.
Yeah.
That's amazing. But I want to, can I repeat what I think I've heard you say?
Absolutely.
Okay. So it is membership based. Is that what you said?
Just for my program. A lot of the other programs are 100% free.
Okay. And I'm not opposed to a membership because, it doesn't mean it has to be $100,000 a year to be a member.
Actually,
right?
Just to give you an idea, based off of your income, it is either $40 a month or $45 a month. And
Yeah.
children are only $10 a month. It's very reasonable
Yeah.
for a family to be on here. And the uniqueness behind it is if, say mom has insurance. So I have insurance here.
Okay.
Because I have employer insurance.
Right.
But my kids are actually on Access Medical.
Okay.
So, and then my husband has something else through his employer. So that's also the unique thing where no one's getting penalized because part of the family has something else.
Right.
So some people just have their kids on it.
Yeah. I mean, that is amazing. It's amazing. I'm just trying to take it all in. So technically, and I'm going to use layman's terms, and I realize I'm not trying to put words in your mouth, but just in order to understand what you're telling me, technically, you're health insurance.
Without being health insurance, we are not. We're a discount program, but we are in the sense of we still follow the same rules of insurance. We still follow referral processes and all that.
Right.
It's just that we're not approving anything. Like with insurance, you would have to get something approved. If you could afford it, you could have it done.
Right.
And that's the big difference for us because we're not insurance. We don't have a lot of the red tape.
Right. So really, but you can't be covered by insurance and access.
No, you have to be
uninsured, which in this state, we have more than enough uninsured people.
Absolutely.
All right. Oh my gosh. So insurance without, we're not going to call it that. We're going to call
because it's not.
Right. It's a discount service that allows the individual to access healthcare that maybe they wouldn't be able to afford to access even if they were insured. One of the things I had a conversation with someone the other day is I am insured, but I'm what I call the definition of underinsured.
Yes.
Right? I am the definition, and I work for a great company. It's not the company's fault. Insurance is a crazy industry. I don't even pretend to know how it works, but one of the things I used to say is when I first started out, I had insurance, but I couldn't afford the copay.
Yes.
So great, I got insurance, but I can't go because I can't afford it. So I think just people don't understand
exactly
different kinds of craziness that goes on.
And we will never compete we can't with anything. So we will never say, don't take insurance, don't do that. But we've had people come on who said, I can't afford my insurance anymore. So I've opted to cancel my insurance and come on your program because for my family, it's been beneficial. But we will never encourage that or anything. No. But there are people who do because insurance isn't affordable. I mean, my kids are on this program because through my insurance here, I could not afford the monthly fee plus everything else so for instance, my little guy wasn't feeling well. I took him to urgent care. It was $85. That's it.
Wow.
$85. I'm not getting billed later. He
Yeah.
got tested for the flu and everything while we were there, and that was it. That's what I paid,
Yeah. And
and
I love that idea, right? I mean, like, I want to know, just tell me how much it costs. Now, if it costs me $285, then I need to plan for that, right?
exactly.
But if I
Mhm.
know upfront, and for a family, that is awesome. And when you think about, not that I'm comparing, I love insurance. Again, I'm not
Absolutely, yeah.
bad mouthing anything at all. I'm just saying, um, for a lot of people, if 45, even $50 a month for health insurance, not insurance, for a discount program, sorry, I'm gonna get it right, I promise you, for a discount program is awesome. That's
Yeah.
awesome.
And they get access to all, like I said, these providers. But what I love about our program, and this is what Myra is.
Yes.
Myra specializes as she is our cancer care coordinator.
Oh yeah,
But
we're gonna drill down with Myra in a
yes,
minute for
yes,
sure.
absolutely. Is that every member gets a specific care coordinator, and that care coordinator is going to navigate them through the whole system. So if, for instance, I come on, English isn't my first language. I am like nervous who I'm going to go to, who's bilingual, who's going to help me. That care coordinator is going to ask the right questions. What do you need to be seen for? Yes, they have a Spanish speaking person. What things do we need to tell that office before they get there to make their experience better? That CC is going to do that. We call them CCs for the care coordinators. And we're just making sure that they know how much it's going to cost. So say you have a surgery. Say you're going to have a $5,000 surgery.
Mm-hmm.
Myra wouldn't go, okay, it's $5,000. I scheduled it for tomorrow. She's going to have a conversation and she's going to say, this is how much it costs. This is the day you have to, because we have to pay for our surgeries a week in advance. And what does that look like for you? How long could we push this back? And say member says, you know what, that's a lot of money, but I have to have this insurance. I'm gonna, maybe I'm gonna borrow money, maybe I'm gonna have a bake off, maybe I'm gonna ask at my church. I mean, our members go above and beyond to get what they need. It's amazing. And say all these things happen, Myra's gonna go, okay, so we're thinking it's good. You 6 weeks. You can do it in 6 weeks. You want to schedule that appointment now. They'll schedule the appointment, but Myra then is also telling that provider, this is why we pushed it out so far. Member is working on saving the money. No one's ever in the dark with our program. And I think for me personally, that is why I love it so much, because we answer our phone. You could
Yes.
come see us in person, not right now because of COVID-19. You could only
Yeah.
talk to us on the phone, but in general, you could come to us in person. If you had a surgery and you later got a pathology bill that was not a part of that 5,000, because that will happen, you can come in. We're going to go over that bill with you. We're going to price it out, make sure it's at the discounted rate. We're going to reach out to the provider, set up a time you could pay it. There's nothing that you're going to go through alone.
Mm-hmm.
I think
And
the
go
sorry,
ahead, Myra, sorry.
I think the best part is that you are assigned to a care coordinator, a CC, and you know who to talk to. It's not a different person every time. You build relationships with your members, your CCs. So we have members that call like, "Is Myra available?" We're like, "No, not today." She's like, "Okay, I only want to talk to Myra.
Yep.
I'll call back."
Yeah.
So it's definitely a different relationship where I feel like I know them personally. Um, when you call other organizations for health services, you speak to a different person every time.
Yeah.
Maybe they don't speak Spanish. Sometimes I'm their Google Maps.
Yeah.
I'm like, you turn here, you turn this, or or let me send you a copy of the map. So we try to give them all the resources for them to be successful on our program and with their services.
Yeah.
Right.
And our biggest goal is that for our department, I think it is our mission and our culture at AHN anyway, is that if it was our mom, if it was our cousin or aunt, and they had nobody to guide them,
Right.
how would you do it? And so the CCs, it's always like, okay, this is how I would handle it if it was my mom. And that's what makes Myra so unique, is because when you're coming to cancer care coordination, it's very different, and cancer is very expensive, even with our discounted rates, but you have this person who is holding your hand the whole time. And sometimes for some of our cancer members especially, Myra is the only person. There's no family, there's no support system, and we're the ones going, Myra, there wouldn't be enough kudos in the world to say what she does for our women, because these women come in, I mean, generally she's talking to them and they've just found out.
Yeah.
I mean, sometimes same day, like they're, you know, that provider's no sooner referring them to see if we have Komen funding instantly. And when you have someone who just basically, lack of better term, got kicked in the stomach,
Yeah.
and you could get to their level and you could say, we got this, me and you together, we're going to get through this, and it's not going to be easy, and we're going to cry together, and we're going to figure it out, and we're going to laugh, and we're going to see what we can do. It's every day it's a great day. I tell my staff all the time, I'm like, every day we save someone's life, we change someone's health outcome through the communication that we have. And we're so blessed that we have Komen funding that also helps with treatment dollars. But it's the relationship. And Myra's, not only does she have that relationship with the member, but if you don't have it with the provider, because there's a lot of stuff that we've had providers that have said she no longer could afford it, we're going to have to stop, like maybe it's the very end of treatment, and providers say, okay, I'm going to write off this much. And why? Because Myra has that relationship where she feels comfortable enough to call and say, I'm laying it all on the table, we need some extra help.
Yeah, that, which I mean, and we're going to cover that in 1 second, because obviously my mind is reeling at this moment in such a great way. So I wanted to ask, I wanted to repeat, because I think we said this before we started recording. You access to healthcare, which, by the way, is the world's best descriptive name, right? What a great description of what you guys do. I love that. Access to healthcare is the entire state of Nevada, not just Reno and Las Vegas.
Yep. Right. No, entire state. Certain programs are not in every county.
Sure.
Yeah, like our transportation and stuff is primarily Washoe County, but that's always changing. I mean, we literally feel like we're always running, because every time we turn around, the grants are changing, and now they're like, oh, guess what, you can go to this county. So we always tell everybody, just call and ask, because it changes all the time.
Yeah, and maybe we'll figure it out, right? So
exactly
knows, right? But just in terms of, and I actually had this conversation with another Q&A group, and I really appreciated it, was even now, I'm assuming that a lot of your practitioners are doing phone medical visits. So it's even easier for rural areas of Nevada to access providers, because they're more open to this kind of connection. So
it's the new thing. It's our new normal.
Yeah. And I actually think, again, I said it earlier, more and more things are happening that are actually working out for us during this time, right? Like, who would have thunk? And what a great idea. So especially for the rural areas. Now, an emergency situation, different. I'm not talking about, you're in the middle of a heart attack, but I'm just like, so random, I have a rash on my pinky. I am going to call my doctor when we're done with this and make her look at it, because it's driving me crazy, but it's not an emergency.
Exactly.
So I love that. I really, really want to stress that the rural areas of Nevada, which I realize it's hard for them to access healthcare in some instances, that this is a great option for them, correct?
Absolutely. Yep. And we're contracted with most of the rural hospitals as well, like Humboldt General.
Yeah, that's awesome. Just wonderful. All right, so let's shift gears for a second. And that is one of the reasons this whole thing started was when I started with Susan G. Komen. They handed me a list and said, oh, here's the grants we fund.
Yes.
Great. What does this mean? So tell me, is this a self-serving question? I apologize if it is, but tell me what Komen grants for you guys.
So Komen grants us treatment dollars.
Oh, good.
So our women have already been diagnosed.
Okay.
So we're not doing any mammograms, anything like that. They've been diagnosed. These are next steps with the oncologist.
Oh.
So our money is fully treatment. And then what I love is that we have built such strong relationships with all the other Komen recipients because some of them, their funding is different.
Right.
So we may have, you know, let's say Red Rose has a diagnosis. They know instantly to send it to Myra for the treatment side of it. So once they've used their funding up until where they can, then they'll send them to us to move with the next step. And that's no different with the funding that Renown holds. So their Komen funding, they'll do the same thing. They'll be like, okay, we're going to cover this, and then we're going to stream it to you. So the really unique partnerships we have made has taken the funding we get and with our discounts and with utilizing all of the different type of Komen funding, we are able to stretch these dollars so far that there's times altogether we're almost all paying for treatment, that there is very little out of pocket. That's life-changing for someone, absolutely life-changing. So that is the biggest I think job that Myra has to do, is figuring out where do we come in or where do we step out and let someone else come in.
Right.
So that is basically what our funding is for. And I want to say last fiscal year we served 30 women, 31 women. So there's never enough money, as we all know. So please, anybody watching this, please donate because you save lives. You absolutely save lives. And our lives are all ages, all races, all everything. We have, sadly, we're getting younger and younger. That is very scary how that's starting to, we've really noticed that in the last year, that it's a younger group of women. So we have mamas that still have little kids at home, and you know, so we use our funding for treatment, and then it's like, okay, where else could we get them money for something else to help, maybe with housing or whatever, and you just pull from all these pots to get them through it because they're uninsured, and their Komen is it. You know, there isn't funding out there for treatment, but Komen is, and we've been getting Komen funding for years, and it's a constant thing.
And we will continue. After this conversation, I can tell you another reason why I love connecting is because we're in crazy times, as we all know. It's not like we have to reiterate it every moment of every day, but our commitment isn't changing. Our commitment to you guys, we're committed.
Absolutely.
So Myra, if you don't mind me asking, Myra, I want to ask you, just so I feel that it's better for our constituents when we're able to do something like this. So they have been diagnosed, that's been elsewhere, might be the Mama Van, might be Red Rose, right? We have those opportunities. Also partners that we fund through our grants. So now they're moved to you. This woman has just been diagnosed with breast cancer. Your first conversation is a fact-finding mission. Am I understanding that correctly?
So our first conversation is, I try to be very aware of the situation and emotions that we may, both myself and the woman may be having. So it's a lot of questions on my behalf. It's more of like, who referred you to me? What did your physician say? More of just very gentle, and what services do you need? Do you have any referrals? And then we say, okay, well, let's go ahead and sign you up. And then I will call your physicians and see what's the next step and get copies of orders and see where we're going. So we always want to know what the plan is first.
Right. I'm going to ask, this could be a silly question, and I apologize, but actually I want to ask two questions. I'm asking them together. Number one, how do you handle, or are you able to handle, people that may not be here legally? And two, what if they were diagnosed in another state? And and this is typical of me. I'm going to tell you up front, if I were diagnosed with something, my first response would be to ignore it. That would be my first response. Not a good one. I get it. But let's say that is what happened. 5 months have gone by, they've moved here and they have no insurance, and now they're connecting with you saying, so 5 months ago I was diagnosed. How do you, can you work in both of those situations? Is it possible? Okay.
Well, first of all, we never ask legal status.
That's what I wanted to hear.
We never ask that. We're here to serve a human and a woman,
Great.
And that's it. So as HN as a whole, for most of our programs, that's not what we're asking for.
Okay, that was my roundabout way of finding that out. So, and mind you, I get when you have to, right? I'm not, again, not condemning, but I just love that there's other opportunities. So we do not ask that question. It is not, you don't have to prove.
No.
I love it. Okay. And you obviously have a lot of Spanish speaking. Do you have other languages that you can provide? It's just based on the provider, correct? There might be Italian. I'm Italian. I always ask, does someone speak Italian?
Yeah, no, and a lot of our providers, especially in the hospital systems and all that, they have all the translators and all that. For all of us, all the staff here, it's all Spanish speaking.
Oh, that's great. That's absolutely fabulous. Okay, so take the question about citizenship off the table. Tell me about someone that maybe, like me, is a ignore procrastinator.
So I would definitely see if you have any records, and we could definitely enroll you and, send you to primary care and or specialist to see what's next for you.
Okay.
If that's, maybe you need radiology to confirm the diagnosis.
Right.
Maybe you have your records and they're like, no, you need to see an oncologist. So that's something that all those barriers we've come across. And
so I'm not the only one. Is that what you're telling me?
Yeah. Well, and sometimes it's not just like procrastinate. Sometimes it's financial, and people get so scared because cancer in general is so expensive that they just let it go and they don't go the next step to even find out if it would be manageable. So we've had women who come on and they've got diagnosed 12 months ago.
Yeah. I feel like that's one of our goals here is we're trying to get more vocal about that, and we're going to do some really interesting things about that too. But I love that that's also your guys's thought process is let us help you figure out how to navigate it, right?
Yeah.
Yep.
I mean, that's amazing. And there are so many services available. I feel you guys, more than me, probably have a pulse on that. So at your fingertips, Mayra, you have a list of resources of partners that you go to often anyway, correct?
Correct. That's true.
That's awesome. That's amazing. So now, okay, I'm going to ask this silly question again. What you do, Mayra, is that only for members of Access to Healthcare?
So anyone can call me and ask me questions. I'm very open and very helpful. For what we do is if we enroll you, yes, we will navigate you. If our program wasn't the best for you, then we will say, okay, let me refer you, let's say, to the social worker at the hospital, or let me refer you to this other program. So there is always a soft transfer to the service that you need.
Right. And you told me you had a call center, Dena. So that call center is really the best option, right?
That's where you're going to stream through. Yep.
Yeah. So pick up the phone and make the call. And here's what I notice. I do know this about a lot of people, and it used to be me when I was in high school. I was shy, believe it or not a shy bone in my body at this point. But the idea of picking up the telephone and asking a business what their hours was mortifying to me. Like, I wouldn't do it. Now I don't even give it a second thought. I'll call them at 11 o'clock at night to find out if they're open. But I think a lot of it is knowing that the person at the other end is there to help, not to slow you down. And that's how you guys feel you look at it, correct?
Yep. And we're here Monday through Friday. Our department is 8 to 4:30. Our members can call us, email us, fax us, whatever they need to do to get a hold of us. And for us, we have 48 hours to get back to you, but for the most part, the ladies are getting back to you same day.
Right.
So it's very manageable that we have a very sense of high touch for our members, that we don't, because the biggest thing I see in healthcare is that we lose people to not replying to their need.
Right.
So, it's granted, everybody's so busy. So it's super important to our organization as a whole is that if someone calls you, you're calling them back.
Right.
Because you wait 2, 3, 4 days, 5 days, they've already lost their investment.
Mhm.
And so there's that constant let's get a hold of you, let's leave messages. We text our members any way that makes their life easier, because they work, they have jobs, they have families, so we just do the best we can.
So, and then are you guys not at capacity right now? Is there room for more
Oh yeah,
members?
Oh yeah, there's
absolutely.
always room.
I
Always
love
room.
it.
Always room. Right now, statewide, for our program as a whole, we have over almost 7,000 members right now. So, but no one's, the reason why we always have room is because no one's really, I'm trying to word it right. It's not that they're not active, but you're not always going to the doctor. So
Right.
even though you're on the program, you may not have something right now. So they always have maybe 60 to 100 active members that are going through something that needs to be referred to or worked on. So there's always room to add more. And as we grow, we add more CCs, because we don't ever want them to have so many that they couldn't still have that true one-on-one with a member. Like
Right.
Mayra has, out of everybody, Mayra has the lower caseload of people
Yes.
because her cancer members get and deserve more time than just an
Exactly.
average member.
Yeah. And Myra, just to clarify, you do all cancers, correct?
Yes, I do all cancers for statewide.
Are you finding, I do know that breast cancer, it's starting to show up younger and younger for us. Do you find that's true of most cancers, or
I
are
think
we at a
across the board
reprieve?
it is. I think we've seen definitely on our program that they are being diagnosed sooner, and we think it's because of preventative services. Um, and and we have, in the past it was just breast because that's what we were known for, I feel like. And now that the community is getting to know us and the word is out, they reach out to us for all cancers.
Oh, that's great. That's great. And I think that's important to I mean, although I'm Susan G. Komen, my focus is breast cancer. My own personal belief is let's get rid of cancer. Cancer is not
Absolutely.
helping anybody, and we
Well,
No.
anything.
don't need it.
Yeah, we promote any preventative. That is our
Yeah.
biggest push for our program, is even if it's the dentist, go to your cleanings, because
Yeah.
Yes.
long term, you get a toothache and you've neglected a tooth, it makes all of you sick, your whole body's sick. And
Yeah.
so everything we do with the CCs are constantly pushing the preventative. Have you gotten this checkup? Have you done this? Have you had these labs done? Because healthy, everything affects the other part of the body. So we're
Yeah.
really into, like, let's be as healthy as we possibly can. And I mean, we even offer nutrition classes here. And if someone says, we have a heart and vascular care coordinator who helps all of our members that have heart and vascular disease. When she reaches out to them and say a member says, well, I'm used to eating, a half a loaf of bread a day or 20 tortillas a day. We don't say don't eat it. We just
Right.
say, well, let's start small.
Yeah.
Let's make small
Mhm.
changes. And so that's kind of, I think, the idea for all of the care coordination is, like, we're not trying to change their whole life in one night. It's just like, let's do little things. Let's start saving for your health. Like, we have a health savings program here that one of the banks match. So if
Oh,
they put in $50 a month, the bank matches $50 up to $1,000. So we
okay.
have all these different programs here that really are trying to say and give you the education you need to be a healthier you.
You guys are, I mean, you two personally are lovely.
We're all right.
Thank you. Thank you.
I am just, every day that I reach out and I connect, I am just absolutely blown away by what is possible. And just as a personal note, that you guys care enough to reach out to the entire community, or the entire state of Nevada, which I appreciate your guys' service as well. And as an organization, obviously, Susan G. Komen loves you guys. So,
And we love you
the
guys.
same.
so I'm literally almost speechless. I'm like, my mind is trying to wrap my head around all the things that you do. So I do love the idea of the call center, because if I jokingly tell people I'm a genius. I'm a genius and I'm a liar. So I love that you guys do say you have time via call center to talk to people and find out where they're at and what services they may not need every service you offer, but there might be something that is really perfect for them, and they should go ahead and call.
Absolutely. And if it's okay, can I say the phone number and our website?
Yes.
Okay.
And I will also put it on our post.
Perfect.
So I'll put it on everything I post as well.
All right. Our number is 877-385-2345, and it's accesstohealthcarenetwork.org. And obviously you'll put it on everything. And either way, even if you go through the website, you could actually get a hold of us through our website, and then we'll call you. So either way, whatever makes it easiest for you. And if someone's like, I can only talk from 12 to 12:30 during my lunch, someone's going to call you between 12 and 12:30.
Oh, that's awesome. Now, I just want to ask again, are you only funded through grants? Is that your only funding?
So our membership fee for our program funds our program.
Okay.
We have Women's Health Connection is funded by grants.
Okay.
We have Aging and Disability Resource Centers, the State Health Insurance Assistance Program, Ryan White programs. Those are all funded through the grants. Those positions, everything, those are fully funded.
Right.
Ours is fully, all these care coordinators are fully funded off of our membership fee. Same
Awesome.
with me.
That's great though. I mean, I love grants. I love giving grants, but it's always very comforting when it appears to be self-sustaining, so it doesn't go away if the grant goes away.
Yeah.
Like I said, this has been over a decade.
Yeah.
What are we at, like 13 years now with this program? And this is the program that is the foundation for the company. This is the program that built it, and then all the grants actually came later.
Yep.
And now it's just a big, the company over a decade, it was 3 employees, and now we have over 110 employees statewide.
Wow. That's a lot. I do keep looking at the clock because I told you, let's stick to 30 minutes. I haven't done it in the last 4 interviews I've done. I think I'm just going to automatically in my mind switch these to an hour. But I know you guys have places you have to be. I could go on forever. The truth of the matter is you guys have so much going on. So tell me the 877 number one more time.
It is 877-385-2345.
Got it. Mayra, if your phone calls go up in the next couple of days, can you give us credit for it?
Yes, we definitely will.
You're so
and yes,
funny.
please do, because as a nonprofit, marketing isn't in any of our budgets. So everything like this that we do gets our message out. If it wasn't for our providers and our members, I mean, that's how, you do good work and people tell other people. And that's how, so I was so excited to do this in the hopes that it would get more people to say, hey, did you know about this program?
I agree. And I will be saying that more often too. And also I'm going to change how we connect to you through our website. Because right now it's a bunch of words, right? A bunch of words that nobody's going to read. I'm going to do it a little more succinctly. So this has inspired me to clean that up as well and make it easier for people to contact you. And I cannot tell you how much I appreciate that you ladies were willing to join me today. And
thank you.
And educate us. So thank you so much. And you know what? I feel we will be talking to you again. Absolutely.
We would love it.
We're looking forward to that.
All right. Thank you, ladies. Bye-bye.
Thank you. Bye.